Let's see, is there a question in the chat? Let's see what's going on there. Okay. All right, so looks like we got a small little intimate crowd today. I'm Kimberly Dees. Thank you for joining us for our final event for this year's Black in Data Week 2024. As I mentioned on Tuesday, I guess it was, this is part 2 of an intro to KNIME and then a demonstration of how you can use KNIME for health disparities research studies. So a little bit of I think everybody here knows my background, so I'm not going to go through all of that. I'm a senior health data scientist, also a PhD candidate in informatics. And I guess I should say all that because we're going to put this on YouTube. I'm actually attending the Black in Cancer meeting here in Bethesda, which is why I only have one screen. So hopefully you all will be able to read everything. It'll be nice and legible. And if you have any questions, feel free to drop those in the chat. And if I can't answer them directly, I will certainly get back to you. Yes, Jessica, we are really juggling today, but it's all good. I was really inspired by a lot of what I saw today at Black in Cancer, people that I've admired for years, a lot of their work. I think I might have mentioned that I'm doing a fellowship this summer looking at prostate cancer and looking at computational models that can address drug resistance. Castration-resistant prostate cancer means exactly what it says, that they castrate certain genitalia and you still have a problem. So obviously we want to develop pharmaceutical products that can address that issue. All right, so on to something a little happier than that. I'm going to be looking at a data set from the HIV VU website, or did I get it from CDC? One of those two, I can't remember now. And also looking at some crime data. So what I want to do, the goal of tonight's session will be to show how I can use KNIME to just run some simple analysis, do some basic data visualizations, and this is real-time analysis that could literally be taken to the health department in Chicago and say, hey, look, this is something that we might want to think about looking at. And that's actually a lot of the reason why I left the bench and started doing data was because, you know, it takes, what, 15 years to develop a cancer drug. And I thought, you know, I was going to discover a drug at some point and realized that there are some things that I can do in real time that would be probably far more beneficial to disadvantaged communities and especially Black communities. Okay, so with that said, I'm going to go ahead and share screen. And like I said, you all let me know if it's not big enough. It won't be a whole lot I can do, but I'll do the best that I can. So I'm going to start with kind of where I left off from before. So I'm going to start with the KNIME Analytics platform, and then we'll talk about some of the analysis that I'm going to do. I'm going to take a look at some data, and then we're going to run some analysis, and then you'll be able to see how it works. All right, so let's get this party started. Widen this screen to I can see share screen. There we go. Okay, this is my KNIME. So when we left off before, I was having some troubles going from the new updated user interface or UI to what you see today. This is the old one. So I literally figured it out a minute after the meeting ended last week or Tuesday. So as I mentioned before, KNIME is the workstation is, or the workspace is broken down to specific sections. You can format this however you want, but in the center, I always have my biggest section be the actual place I'm going to put my nodes and do my analysis. But I always keep this left-hand panel pretty much the same. So it's the KNIME Explorer, which gives you all the files that you've already created in KNIME. Then under that is the Workflow Coach, which once you put a node into your workspace, it will tell you what percentage of the community actually used it for their next step, which I find, you know, supremely useful. And then finally, your node repository, where you can either double click or you can drag and drop a node, which remember, they're color coded. These are reading in data. These are doing some type of manipulation of the data. And then the red colors actually mean it's a node that we're going to use to export. Okay. So data one-on-one, before you do any analysis of any sort, you should first do what? I'm going to ask a question, get some interaction here. What is it you guys think you should do first before you do any analysis? And you can unmute yourself if you want to share your thoughts on that. Okay, so this is just a matter
put together.
I'm sorry, go ahead.
Put together your problem statement hypothesis.
Okay, that's definitely a first step. And maybe I should have been more specific. Something related to the data though.
Oh, aside from gathering it?
I'm sorry, say it again.
Aside from gathering it, or?
Right, aside from gathering it. So you got your hypothesis, you kind of have an idea what nodes you kind of want to use. What should you do before you even start doing anything at all with that data?
Oh, clean it up. Make
Okay.
sure it's clean.
Okay, so sometimes you can do that. And actually, sometimes, to be honest with you, Jessica, I don't, especially if it's a new data set, I don't always know what it is I need to clean up because I'm not sure sometimes with the question, I have an idea of the question I want to ask, but I don't necessarily know if the data is going to map to what I'm asking. But the thing you should do before you do anything at all is look at your data, right? You would be surprised how much time and trouble I've saved myself just from looking at the data, because there's some basic things that I think are easier to do in Excel than to do in Python. So say, for example, if I know I have, or I think I have missing values, I usually clean those up in Excel because I think it's easier than to import it into Python, write some code, do a miss NA, and then, I do it in Excel. So before you even import your data into, whether we're talking Python or R or KNIME, look at it. I have been surprised and had to literally stop a project and say, wait a minute, we need to talk about this. And so that's why, as a matter of practice, when someone tells me or asks me, well, how long is this going to take? Or can you do this in a week? Before I even answer that question, I say, let me look at the data and then I'll answer the question. Because to your point, Jessica, you may need to clean and munge and merge, and it could be 15 different ways to spell San Francisco. You know what I mean? So always look at your data before you import it. So that's what we're going to do now. I'm going to share with you what the data looks like. So there are two different Excel spreadsheets. The first one is going to be the crime spreadsheet. Now, is that reasonably legible to everyone? Like a thumbs up if it is or not?
Yes.
Okay, fantastic. Okay, so we have a number of different, this is from the FBI website. So we have a number of different columns. And as you can see, I've already started to do some stuff. Like I did a pivot and, did a lot of different stuff. Anyway, so I look at the data first. And one of the first things, well, first of all, I knew I wanted to look at community level information. So one of the first things I knew going in was that I was going to have to change the column name for community because the HIV data I'm pulling is from a completely different source. This is from the FBI. They both have a way of representing the community name or number, but they call it something different. So I already know going in, I'm going to have to do some changes. Now, I actually put the changes that I'm going to do into the KNIME workflow because I want to show you some functionality with KNIME. But normally, this is something I would do going in. I would know that, I think this column here, so community area, they call it community area here, right? I know going in, so to your point of looking at my hypothesis first, or, whatever I think I'm going to be doing my analysis on, I do some basic cleanup here just because I think it's easier than to do it programmatically. So community area is the numerical value in the column that I'm going to be looking at. And so knowing that, I might check to make sure that it's in the proper format as a number. I'll leave it as general. That's fine. Although that can be tricky if you have another data that you want to join it, another data set you want to join it with, and they have characters and numbers mixed up, that could kind of be a problem. So in this case, I'll just go through the column. So we have ID, I think that's specific for the source of the data, case number, that's actually a police number. If you went to the crime site for, I guess it's a city, is it Cobb County? At any rate, you could use that number to get more information about this particular case, which we don't want to do. We have the date, the block, the IUCR, I forget what it stands for, but it's a designation by the FBI about crimes. The type of crime, description. So one of the things that I learned in studying HIV at the community level was that many of the women who become infected with HIV do so as an act of violence, and they live in areas where there is high crime. So I know from my previous research, particularly as it relates to my dissertation, that I've been able to, in the cities that I'm looking in, right? So in Houston, in Dallas, in Fort Worth, there's an association of crime and HIV prevalence. So I was curious to see if something similar would be the case for Chicago. With that said, with this data set and the HIV information, you could come up with any number of different types of analyses. And one way that you could, decide what type of analyses that you want to do is to take your data set, put it in ChatGPT and say, hey, what types of insight can be drawn from this data? Okay. With that said, ChatGPT is not the most reliable thing out there. It's useful. So that's where you kind of have to have experience. You can't rely on that. If they come back and say something that sounds ridiculous, then you got to know, okay, this sounds ridiculous. So that's where ChatGPT is a tool. It can't answer a question for you. You still need to have some expertise. In this case, I still needed to have some community level information about HIV to know if whatever they came back with made sense to even look at. All right, so let's see. And they also have XY coordinates. So, you can import this into Tableau. You can actually look at maps to see where different things are. So you can come up with a wealth of different types of experiments to do. So in this case, I'm not just interested in crime, but violent crime. Because again, my hypothesis is that wherever I see a high prevalence of HIV, I'm also going to see a high prevalence of violent crime. So this is the basic data for crime. Now I'm going to share with you the HIV data that I have. All right, so I can take that one off and let's look at the HIV data. So remember, I definitely want to have the areas, right? So the one thing you're going to notice is that the area names will probably have different column titles. And so what I'm going to do in KNIME, like I said, normally I would do this in Excel, but what I'm going to do in KNIME is I'm actually going to change the column just again to show you the functionality. So this is actually not the spreadsheet I started with. This is just something I kind of was able to, actually I can show you to start with. Here it is. Okay, I actually have it here. So this is what this came as, okay. This actually was from a PDF. So I imported this PDF into Excel and this is what it gave me back. And then from this, I kind of played around with it. So this is the second spreadsheet that I was able to play around with. And then I came up with the final spreadsheet of what I needed. Now, I'm a person, everybody's different with how they handle data. So as you know, with CSV files, you don't have multiple tabs you can look at. I have a habit of, even after I get this, I know that I want tab 3. I always take tab 3 and save it as an Excel SX or as a CSV file, because I want to be very sure that I am using the right data. Okay, now if you got it like that and you can manipulate the tabs around and keep track of all that, I think that's great. But once I get this final data that I want in Excel, I'm going to export this and save it as its own individual spreadsheet. I'm going to keep it here because I like redundancy and backup, and I've frequently had to come back to my backup data. But that's kind of the way I work. Okay, so do we have a question in the chat? Okay, that's Jessica being her gregarious self, networking. I am not mad at that. So happy to see you attending again, Jessica. All right, so let's go now so we looked at our data. We have some kind of general idea. I do I look see if there's missing information, if I don't think there's a whole lot here. If there's, every row has all the numbers filled in. Okay. So with this, I was trying to decide if I wanted to look at HIV rates, and I chose to go with actual numbers because I think numbers are more informative, quite frankly. And a lot of times there's nothing wrong with dealing with rates. The problem is that the people that work at community-based organizations that work with HIV are not statisticians, and they won't know that prevalence rate can mean something very different than the actual number. So I always go with cases versus rates. That's just a personal preference. It really depends on who I'm doing this, the presentation for. In this case, I always assume that I'm presenting it to a 5th grader to, kind of play on a saying that people have, but I try to keep it simple, right? I don't want to have to, if I use prevalence rate, then that's a statistician. That's not going to be real helpful for the community because they probably don't have a statistician working there, okay? So prevalence rate, everybody understands the raw numbers. Okay, so now that we've looked at our data, now we're going to import it into, I'm going to go through the protocol of how we would import that into KNIME. So when I was talking about it the other day, I mentioned that I like to section off the different functionalities that I'm using in KNIME, just as a matter of habit to keep track of everything that I'm doing here. So there's a data pre-processing step, which I don't have included here because I did that in Excel already, right? So that's to Jessica's point. And then I'll have a data import step, a data cleaning step, data merging step. So I talked about that being a lot like SQL. And then finally, I'll export that as a combined file. So what am I doing here? So I'm reading in my CSV file, and I'm also reading in my HIV prevalence file. But I already know, because we talked about it, that one of the columns I want to look at aren't named the same. So then I have to use the node called column renamer to make sure they have the same name. So I rename those, and then I merge them and then export them as a combined file, which I can then do data visualization on. All right, so I'm going to go a little bit more into, let's hope my mouse is working. Great, it's not. Okay, so let's go into, we're going to look to how we could configure a node in KNIME. So where did it go? Okay, there it is. Can everybody see the other spreadsheet, or does it still show the KNIME workspace? Because I can't.
It shows the new workspace.
Okay, let me stop sharing and then I'll share my entire desktop and then you'll be able to see everything. I'm not hiding anything on here. All right, let's see which. Okay, I may have to go back and forth because I don't want you guys to, well, let's see. All right, I'll go ahead and share we'll share that desktop. Okay. Okay, can everybody see what's on my desktop now? Okay, looks like you can. Okay, so when you double click on the node, you are able to configure it. So in this view, you're going to see, can everybody see the whole thing? Move this over.
Yes.
Okay. All right. So what we have here is you first have to import your file. So we have two options. You can either go to a custom KNIME URL, which would normally be through the server, or relative to, I forget what that means, but the local file is what I always go with. So I have a file on my local machine. Now, if you had it someplace in the cloud, there's a way to configure that. And I think that's what the relative to is about, but I've never used it before, so I don't know for sure. All right, so you browse, you select your file, and then what KNIME is going to do, or what this node is going to do, is going to give you an overview of what's in the file. So here you can set the delimiter. The default conditions that are already preset always work for the files that I use, so I never change anything, but I do always make sure to let the software know, hey, I have a header, so please use it. So we've selected our file, we've looked at the preview, we select headers, and then you would click apply and okay. So it won't be changed because I've already run this code in preparation for this. All right, so now that we know everything is okay, we go back to our data import section of our workspace, and we can see the light is green. So that means that this node is ready to be executed. And the way we do that is you right click on it and then you click execute, all right, so in this case, I'm gonna reset everything so that I can do it all over. Yes, I want to reset all the nodes. So everything will go to yellow now, okay? Let's reset this one too. So you can see how it works. I want you to see it all the way from the beginning to end. So you import your file, you check it out, you check headers, and then once you do that, it'll go from red to yellow. So that means that it's ready to go. So now you have an option to execute. So in order to see that option, I had to reset it and get the yellow light. I use red light, green light, yellow light for this. So now I'm ready to execute because it's green. And then when I do, it goes to the green side, and now I can look and see what it looks like. So the way you would look at the output is you would click on File Table, and then it gives you what you have. Okay, I'm going to run over, guys. I should have said this was going to be longer than this. So this is the output of the file. Okay, so obviously I don't need all of this. Okay. Now I talked about the pre-processing step. One of the other things that I did when I did the pre-processing step was I wanted to have some categorical variables to describe the type of crime, right? So is it high, is it low, is it medium? So this column was done in the pre-processing step. So I didn't show that. That would have to be a longer talk, but that's one of the columns that I created in the pre-processing step, which I was able to use for the visualization. You'll see that in a sec. Okay, so we do the same thing for the HIV prevalence chart. If you just want to take a look at it real quick, what it looks like. Remember, we had these columns, including prevalence, but we're not going to use those in the long term. And this actually should have a different name. I'm sorry, prevalence rate and prevalence. We're going to use prevalence in our case. Headers are already checked. So we can go ahead and execute that node. Press execute and it's green. And I always check to make sure that it did what it's supposed to do. So you do that by looking at file table and we can see everything is as it should be. Okay, so now the next step was, remember that the columns I want to look at are column area, but they both had different names. So with this node called column renamer, we're going to rename the node. So I'm gonna configure that and just open this node to show you how that would work. So it gives you all of the columns that are in your data set. So these are all of the columns in your data set on the left. So on the right, you give it the name, common name that you want to have. And so I call it com area node. And then you click OK, and then now you can execute that node. Now, for the other data set, remember they had two different names for column area, and this one's already been done. So this was called area number. So you can see, while if I wanted to join these, it would be a problem because they didn't have the same name. So with column renamer, I give them the same name, column area, no, which is number, and then you click OK. So now we're ready to execute this node, and we'll look at the data just to make sure it looks the way it should. And this is what we have. So you can actually, spread these columns out a little bit if you want. There's your data, there's your result. Okay. So now that we have our two columns, I know that ultimately I want one spreadsheet to do a data visualization from. So now we're going to use a joiner node. So this works exactly the same way as it does in, exactly the same way that it does in SQL. Letting me look at this, hang on. Okay, so the way we configure this one, okay, so we have to select the two columns that we want to compare. So obviously we're joining. Does someone have a question? Oh, okay, so we're looking at the common area. That's what we want to join on. So again, you'll get all of the list of your columns here for both spreadsheets. And you just select the one that they have in common, and this one it's common area number. We want matching joins, so we're going to do an inner join, so it's going to match every place that it sees the same information on both sides of the data set. It's kind of the way I look at it. Everyone looks at joins differently, but that's the way that works better for my mind. And then we're going to concatenate original rows with the separator with the dash, okay? So that won't show up at your output. I'm not sure why that setting always has to be there. It just always is. Then we click apply and then OK. And then we can execute that node. And what will we end up with? So some folks have worked with SQL. Do you know what we'll end up with? All right. So what's going to happen here is it's going to join every column from our right and left spreadsheet that has that column in it is going to join. And our join result looks like this. So we end up with 50 rows. So what it did was it basically added our crime data and added the HIV prevalence data, tacked it on the end. And I wanted it all in one spreadsheet because I want to use that one spreadsheet to do data visualization from there. Okay, so now CSV Writer, I won't go through, well, I have to do it again. Okay, so with this one, you have to configure it. So what that means is you have to give it a name. So because I've already named it data 1, I'm going to call it data 5 here, okay? Because if I call it data 1, that's what I used when I did this presentation a couple of months ago. So that means I can't save it with the same name. I have to give it a new name. So in this case, we're going to call it data 5. We click apply, we click OK, and then we execute the node. And what it'll do is it will create a CSV file that we can now use to look at our data visualization. All right, so with that, are there any general questions? I'm going to go about 15 minutes over, guys, so just FYI. Any questions on that? So what I hope I've communicated here mostly is that I know everybody doesn't necessarily care for coding. Troubleshooting can be a pain. This, to me, for the person that wants to do data analytics and wants to have a job in data analytics, but doesn't necessarily want to code, this is a good answer for that. Now, the downside is that a lot of folks haven't really come around to Alteryx or KNIME as a tool for data analytics. But as I mentioned before, I think that's going to change in the future. Okay, can you do anything other than outer? No, those are the only type of joins, just like with SQL, those are the only ones that you can do. What other joins are there actually? Inner, outer, left? those are the only ones that I know about. Too bad DJ Sequel. Sia would know. She's the sequel expert. But these are all that you can do that I'm aware of. Anti-Joe, oh yeah, see, way above my head. We got to reach out to Sia on that one. That's actually not a bad question. But I'm not a SQL expert by any remote possibility. I've used SQL quite a bit, but I am not an expert. But I'm going to ask Sia. So I think I'm going to screenshot this so I can ask Sia this question. That's actually a great question. I don't know. I've never used any of those in SQL. So self-join, yeah, so you done went too far now. Yeah, I have no idea. I'm just the basic SQL person. Get what I need to get done. I have no idea. But Jessica, since you brought this up and you obviously know a lot about SQL, maybe you should reach out to us next year and do an event on the different types of joins. Yeah, this would be really helpful because you know, I've heard of people not getting jobs behind not understanding SQL joins, like literally. So if you want to come back and do a session with us, or maybe even for Black and Data Week. Yeah, I was going to say, I've never heard of them. We'd be happy to have you do that. That sounds great. That sounds good. So I'm gonna hold you to it, Jessica. Okay, so let's move on to doing the data visualizations now, because now you're like, okay, well, what does it have to do with health disparities? A lot of times, especially if you're working with community-based organizations, what I did for the analysis, tables don't really move people much, right? But if they can see how something can be impactful, that can be super, super helpful. And so that's why I tell any data professional a certain level of mastery of data visualization will really go a long way in your career, because ultimately it's what the stakeholder can most, I think, relate to, as opposed to if I show you this table on a chart, you know, in a table, right? So, you know, rows and columns, you know, what does that mean? Well, if you are an expert in it and you know data, it can mean something, right? But if you're not, you're like, I don't care, right? So this is where data visualizations come in. So we import the CSV file. You know, again, I do things a certain kind of way. So whenever I create a file that I'm going to use for something else, I always do a CSV file. I don't really know why. That's just what I always do. So we're going to have to reconfigure this. So before it was ML1, but now we've got to change it to ML5 because I renamed it. Okay, so it comes up. It's only going to show us the first 10,000 rows. Okay, right. So that's the only other thing you need to know about KNIME, is that there will be a limitation on what you can view, but that has nothing to do with what they can process. You can only see 10,000, but I think the most I've ever done is maybe 50,000 in KNIME, and that's quite a bit of data. Okay, so we're gonna hit apply. Oh gosh, it's saying my internet is unstable. I hope it doesn't stay unstable. Apply and then okay. And now we're gonna execute this node and take a look at the data. And this is what we end up with. So you can see it's a lot cleaner than what it looked like before, right? So we just have a clean data set with our crime data. We have our prevalence data. And so now we're ready to do some visualization. Now you may notice that I filtered the data here based on these are all violent crimes that I wanted to look at, because those are the ones that have a role with or associated with areas in the city that will have higher HIV prevalence among women, Black women in particular. Okay, so now I wanted to just doing some basic manipulation. The top four areas for crime by crime type. Wait, actually, I'm gonna just configure that first. Sorry, guys. Okay, so, all right, so I know that there's a certain type of crime that is associated with HIV prevalence. And so I looked at assault, battery, criminal sexual assault. Forget what the difference between these two were. There was some level, I can't remember off the top of my head now. Actually, another one that comes up that's flagged is kidnapping, believe it or not. I was kind of surprised. So this, you know, we talk about you want to clean data on the front end, you want to clean on the back end, you want to pick your columns on the front or the back. You can do it however you want, but this is just an example of how I can look at whatever columns I want to. The green being the columns that I'm going to look for, right? To map to HIV prevalence, and these are just the other crimes here. Okay. in addition to the data, the prevalence cases, okay? So we pick our, well, so first of all, what I want to look at these crimes, but I also want, remember I talked about that category that I created called high or low, right? Now, I don't just want to know about the crime. I want to know if it's high, low, you know, et cetera, for the community areas that we're going to look at. So this is where I used it, looking at it against high, low, right? Because that's the area, that's the measure that we want to compare the prevalence rates to by area. So we click apply, it says reset, and then we click OK. And now we can look at this bar chart. So we're going to execute, we can either execute or execute in open views, which allows you to see what you just created. And this is our bar chart. So hopefully everybody can read it. So I mentioned before, I think these charts are really kind of nice that you make in KNIME. And again, you can export these as a PNG, SVG, any other type of format. So as you can see here, battery is associated. There's a high number of batteries. There's just a lot of crime, you know, that you see here in Chicago, right? So the question is, well, which one is most prevalent, right? So Chicago is known as, has a reputation for being, you know, filled with crime. But as we're looking at this, I mean, high is not good, but based on what you see on TV and here, you would have thought that it would be very high, right? Just based on assumptions. And this is why assumptions and facts, I mean, you know, facts will help you prove or disprove assumptions. And so what I know just looking at this is that I'm assuming just looking at this, that I'm probably going to see high prevalence of HIV because the biggest measure are very high and high crimes. The low crimes are the lowest. Well, not the lowest, but when you combine your very high and high, that's a lot of crime. So I would know just based on this, my assumption would be I'm going to see high prevalence too, right? No matter what, I mean, well, not even no matter what, but in the areas that have high crime, I'm going to definitely see high prevalence of HIV. Now that's just a speculation. And that's why you want to do additional analyses to make sure that what you're speculating on, you're not actually reporting. And see, the challenge with the way a lot of people do things, especially if you meet a certain demographic, is that they'll draw assumptions when the data is right there. All right, so there's something going on in the chat. Let's see. What's the difference between battery and assault? Okay, I used to know this. I'm actually not sure. Let me Google this real quick because I used to know, and I should probably know before I defend my dissertation. Battery and AULT. Okay, the difference between battery and assault is the main difference between the two is that battery involves physical contact and assault does not. So assault can be a threat then. Okay, assault causing someone to fear imminent violence, such as, verbal violence. Wow, okay, nice little refresher for me. All right, so that's the difference between battery and assault. All right, so let's go back to our chart. So as we can see, we know that there's, problem with crime in Chicago, but I would have thought again that they actually have it's not as bad as what the assumptions are. That's what this chart tells me, because just based on assumptions, again, I would have thought everything is just very high. And because that's all you see in the news. And this is why data analytics can be really helpful. Okay. All right. So let's look at the other chart because that's the one that's going to be more meaningful because that's the one where we're going to compare, look at our prevalence. See me raise this up a little bit. Okay, here we go. So here we're looking at the number of cases. So let's just execute that. All right, so here we have, oops, there we go. Let me do that. Here we go. Okay, so first of all, you can configure this however you want in KNIME. I like shades of blue. This is one of my favorites in the summer, so I just went with this one. But some interesting things here. And so some of you may be wondering why I did a violin plot. So I do a violin plot because I want to know what the shape of my distribution is, right? So box plots will give you outliers. I want to know how that relates to the shape of my distribution. So in this case, we see that there are some areas where you have this bimodal violin plot, right? So there's some areas where it's just really high, right? And we know that because when I created did the pre-processing, I created very high, then I created high, and then I had low. And then here we have and this is the distribution for the low. Now, I'm not surprised by, well, I guess maybe I am surprised. I'm never surprised by anything. I should just say that. But for this one, how many? So we have about what, 233 prevalent cases. So here I'm looking at the median. Here we have 180. And here we have 170. So just again, based on my prior research, I would have thought that there would be a much bigger difference between where we have high crime and where we have prevalent cases, but my hypothesis is actually incorrect in this case, right? So, I mean, we do have a higher number, but I doubt if it's significant. So the next step would be for me to do some machine learning models to see if it actually is related, and if so, if it's statistically significant, right? And then of course I would, map that to confidence intervals to make sure that I was drawing the right conclusions about my p-values or whatnot. But I would have thought this number would have been significantly different. Like, so here it's what? The median is 233 and here it's 180. I would have thought it was much different. Now, with that said, let me say this. Normally, when people are looking at crime, they just want high or low. So if I looked at high or low, I put these two together, then yeah, it probably would look different than it would just comparing low. But I compared very high because one of the things I think I learned just in my own, my research is that there are nuances to high, right? And what I mean by that is that, as you can see here, the difference between very high and high, there's a pretty big gap, in my opinion, just based on the mean, right? And so what that tells me, within the context of the social determinants of health now, right, that there's some other things in play that are, pushing why we go from very high to high. There's kind of a big difference there. Because again, if I'm just looking at crime high and low, then yeah, there probably is a big difference between high and low. But if I break down that high into very high and high, now I have to think more in the context of social determinants of health. And that's ultimately what my dissertation is trying to prove and trying to show, is that contrary to popular belief, Black women who become infected with HIV don't do so because they are promiscuous. Let's just take that off the table, right? So what happens is that Black women believe themselves to be in monogamous relationships. Like a lot of women believe themselves to be in monogamous relationships, right? And there are a lot of different reasons why that would be a whole other talk to talk about why that's not the case, right? But the bottom line is that what I think this data shows, it didn't prove my hypothesis, but what it did show to me, again, knowing that there's other factors at play, that I need to take a deeper look at the social determinants of health, because I bet you if you talk about this very high number, I bet you were talking about rape, assaults, you're talking about battery, and that may be a difference between the very high and the high. I don't know. I'd have to dig a little deeper. And so again, I took my prior knowledge and experience and research and said, I don't just want to know high and low. I want to know what the differences, what the nuances are of that high and low, because I bet you, socially speaking, social determinants of health speaking, this very high is going to look different than this high. And I assume that because these numbers are so different. So I don't know if any of that made sense, but the bottom line is that we break this data down and we do it in the lens of health disparities, because we now know that, and it's been proven that social determinants of health, those things that, where a person lives, grocery stores, access to healthcare, educational level, income level, all those things play a huge role in, the ability to maintain health. So if you look in neighborhoods where great schools, great income, highly educated, they have one set of, health variables, right? But if you look at the opposite side of that, which a lot of Black and brown people live in, you're going to see something completely different. So again, this is highly informative. It didn't prove my hypothesis, but it is still highly informative, especially if the overall goal is to improve the health of everyone in the community. All right, so with that said, low has such a long tail. Yeah, like I said, I would break this down. And again, this is why I look at violin plots, because a longer tail, a bimodal distribution there's some different things going on there in those communities where it falls in high. So because we did this by area, I can take this data, look at the area, look at area versus high, low crime, and now I can pinpoint where my resources need to go, right? That's the whole point of doing any of this analysis from a health disparities perspective is where do we need to improve programming? Where do we need to improve, access to transportation? Where do we need to, right? So when organizations are trying to decide what they want to do with their money, we want to help the people. We got all these DEI programs. Okay, well, let's look at the data, okay? Because the data is going to tell you the story. Now with that said, you got to know how to interpret it as well. All right. Okay, so are there any other questions? This is a very basic thing that I did. The next step to this, I've actually started working on it, would be to do more modeling. So I would look at maybe decision trees and K-means clustering, and I can talk a little bit more in the future about why I chose those. And that'll be something that we're going to expand upon next year as I develop my finish my courses, quite frankly, in KNIME and get more well-versed with the software. Okay, so that's going to be it. Again, very simple illustration of how data can be used to inform communities that need the assistance, the programming, the support the most. Personal passion of mine, I hope to be involved with this type of work for the rest of my life. And we'll see what happens. And again, just demonstrating the KNIME tools, very simple analysis compared to R and Python and SAS and all that. And as you can see, very good visualizations. And there's any number with this data set that I created. I could have done any number of things. I could have looked at community area and let's see, I don't know, access to care. I could have looked at crime and access to care in the context of HIV prevalence, right? So there's just tons that you can do with data. ChatGPT can be a big help, but you will still need to have some background to understand what you're looking at. All right, so with that said, are there any more questions? Let's see, at this point, would you join other data sources to dive deeper into the very high category, or would you make a suggestion at time of creating? You know what, I'm gonna tell you, what answers that question often depends on the time frame you have, who you work for, what your stakeholder needs it for, when do they want it. Personally, anytime I see something that's alarming to me, if your goal really is about improving the community, and again, it's been proven in the literature time and time again that there's no group of people who are born to be criminals, right? So we just need to put that to rest, but that the environment that they grow up in contributes greatly to the choices they feel that they're able to make. And I frame it that way because in my mind, I'm thinking you have poor schools with teachers that probably don't want to be there. What do we think they're telling these kids? You're going to grow up and be an astronaut? I highly doubt it, right? So there's this social determinants of health. Again, that whole thing around education and access to care and food deserts and all that, that becomes critically important in how people live their lives. I mean, we just can't get around that. So what data sources? Dashboard in KNIME. I haven't done a dashboard in KNIME, but there is integration with Tableau. I found that out a couple of days ago. I hadn't tried it yet. So you can access Tableau through KNIME. So the answer is yes, you can create a dashboard. But can you create a dashboard independent of KNIME? I guess it depends on what you think a dashboard is. Let me see if I can pull something up real quick. So I think people have a different definition of what that might be. And the reason I qualify that is because to me, a dashboard is let's say a view of multiple different types of analysis. It might be a pie graph that shows percentages of pie eaten. It might be another graph that shows a mini map of where pie is eaten. When I think about dashboards, I think about multiple different types of visualizations in one space. So can KNIME give you that? Absolutely, it can give you that. And it also has integration with Tableau. Okay, is it interactive? Yes, it's interactive too. Definitely you can, I use it when I'm doing modeling in a chemical informatics space. I often, I'll say, okay, I want to look at chemical compounds that are under 500, and I can set, the value of a graph that I've created and just look at those that are under 500, and then I can export those same values out. So yeah, very interactive. It's a great tool. Like I said, I'm not just saying it because I work there. So yeah, so Jessica, back to your point, I think that's the thing about data analysis that, you could probably ask questions indefinitely, right? Especially from a data set like this, there's just so much to consider. And the fact of the matter is, when we're talking about social determinants of health, a lot of these things are confounding. For example, I might be looking at income, but we all know that people's income is often based on education, which means I need to, qualify for education if I'm going to do any type of analysis on that, right? You have to account for that variable confounding your results, right? Same thing with access to healthcare. I mean, when I'm seeing a lot of HIV, like say in a pocket outside of an outbreak now, the first thing I'm going into is access to healthcare, access to condoms. How far do people have to go to get those things, right? Those things make a difference. So yeah, you have to be motivated to want to look at the very high though. So that's kind of where, to me, why we need more people like us doing this kind of work, right? Because I'm motivated to not just to say, okay, there's a lot of HIV. Oh, well, right? Because that to me is what it looks like, right? And I've worked in HIV clinics where I can tell you for a fact that there are some people that was like, well, they're just going to get HIV. I don't have that attitude, because I don't think that HIV, no matter how people want to ascribe it, it's, anyway, I'll get off that soapbox. The bottom line is that this is why we need more people like us to dive into it, because there are some people that would say, oh, well, it's Chicago, it's a lot of crime there. No, it's a little deeper than that. Okay, so I think we will wrap this up. Sorry, this went a little longer than I planned. I'll make sure to make it for an hour next time. But as you can tell, this is something I'm really interested in. And we need more of us doing this work, y'all. That's all I got, because we have a way and a lens of way of seeing things that other people just don't have. Like I said, I don't look at very high crime and say, oh, well. I look at it and say, what can we do? What can we do about it? How can we make sure that people living in these communities have good health care? Because without health, you have nothing. So yeah, thank you, Jessica. Yeah, let's just hope it pays off eventually. HIV is tough for a lot of different reasons. And after I finish my PhD, my HIV career will probably be coming to an end as I work to build my cancer career, which is why I'm here at the Black and Cancer meeting. But I still will be working around health disparities, so that part will always be there. And with that, I want to thank you all again for coming to our event. Does someone want to say something?
Yeah, thank you. I want to ask that. I hope you don't mind me sending you a message on the LinkedIn.
Oh, no. Yeah,
Okay.
do it. No
All
problem.
right. Yeah, so I've also worked with on HIV before, but that was in synthesis, and I now teach, but I'm looking to move into data, and I will have to work with the chemical data since that is my domain.
Cool, nice. Yeah. I found HIV and data to be a real, let me just say this. People are like, oh, we want the data, and you give them the data, and they're like, not that data. Like, what? What does that mean? Right? So it's a tough space to work. God bless everyone that works in that space who genuinely are interested in, eradicating HIV. More power to them. Yeah, it's hard. And a lot of it, quite frankly, has to do with stigma. But that, again, that's a whole other conversation. So with that, I want to thank you all for joining us. Jessica, you are the attendee of the year. If you reach out to us, we will provide you with a Starbucks card for being the attendee of the year this year. And thank you for your support. And thank you all for your support throughout the year. This is our last event of the year, and we'll be contemplating our 503(c) status. We're actually going to be trying to work on that this summer. And so, with that and with financial support, we'll be able to do different things. We're actually hoping to maybe have this be an in-person meeting maybe next year. We'll have to see how it goes. But again, without support from people like you, we wouldn't exist. Again, thank you for coming. We hope you enjoyed all our events. We will have them now. Please don't be looking for these videos anytime soon. It's going to take a minute to go through, especially because Auntie be going off the rails sometimes. So I have to edit that part out. But as soon as we get it ready, we'll have slides and data for you guys to tinker around with if you want. So you can duplicate some of what we shared in our talks this week. And we'll also have the videos available on our YouTube channel. The code will be available on GitHub. If there's anything missing or something that you need, just let us know, reach out, contact@blacktidesdata.com. With that, everyone be safe. Thank you again for joining, and take care. We will see you next year for our events. Bye-bye.
Bye. Thank you.